I've always seen dentists wear those glasses with those things on them. What are those?
Oh, yeah, I have mine. I can bust them out. All right. So we call them loops. So what they are, they're magnifying glasses.
Mhm.
So I have mine right here.
Oh, okay, okay.
So these ones will magnify whatever I'm looking at 2.5 times.
Oh, okay, okay.
The more you can see, the better you can do.
Welcome back, YouTube. I know we've been interviewing a bunch of physicians lately, but today I've got a dentist. So if you guys are interested in dentistry, keep watching. Anyways, Dr. Farhan is a general dentist in the Bay Area, and he will tell us about his journey and how he became a dentist, and also what dentistry looks like um, in private practice. He has some very interesting stories, so stay tuned. Welcome, Dr. Sayed. How are you today?
I'm doing good. Nice to talk to you.
Well, how about you start with you introducing yourself?
Okay, so I'm Dr. Farhan Sayed. I am a general dentist. I work in Santa Clara, California. I went to school at the University of Pittsburgh School of Dental Medicine. I graduated in 2010 and have been in private practice since then. And then I also teach at the University of the Pacific, Arthur A. Dugoni School of Dentistry, 1 day a week.
Oh, okay. So, can you tell us a bit about your background and how you got into the medical field and specifically into dentistry?
So I grew up in South Bay in California. My mom is a general dentist. She's retired now, but I grew up, spending a lot of time in the practice. I went to UC Davis for my undergrad. I had my degree in biological and agricultural engineering. So initially, my plan was to be an engineer, and
Oh,
then in like the first year or two of school, then I kind of realized that I like engineering, but I didn't want to do it as my profession. So then I
okay.
started spending more time at my mom's office, and then I grew to like it, and so I decided to apply to dental school, and fortunately that worked out.
Oh, okay. So, how does the dentistry pathway differ from a normal physician pathway?
It initially is similar. So for medicine or dentistry, you have to do your prerequisites in your undergraduate education, and usually that entails getting your undergraduate degree or your bachelor's. There's certain prerequisite courses you have to take in order to be able to apply to either dental school or medical school. And then there's a prerequisite exam that you have to take. So
Oh,
for
okay.
medical school, it's the MCAT, which most people have heard of. For dental school, we call it the DAT.
The
And
D
then there may
what?
be other prerequisites that I'm not thinking of right now, but it's usually the coursework that you take at your college and the dental exam.
Okay.
And then based on that, then you apply to school, you get interviews, hopefully you get accepted.
Yeah.
And then once you're in dental school, most schools are a 4 year program. The one that I teach at part-time, UOP, University of the Pacific, they have a 3 year program.
Oh,
Uh, I would say all of the medical schools are 4 year programs. The Once you're into dental school, usually the first 2 years are uh, you're going through your sciences, and then you're also working on like mannequin plastic teeth, so you can learn your hand skills.
mhm.
In
Yeah.
medical school, I believe the first 2 years are just sciences, like it's all just
Yeah.
book learning. In dental school, then in your second 2 years, or your final 2 years of dental school, then you're working on patients. So patients come
Oh,
and then you work under the supervision of supervising doctors
okay.
to render care to your patients, doing exams, cleanings, fillings, crowns, just
Oh,
different procedures under supervision, to the point where then we can say that they're qualified to get their degree and their license and start practicing on their own.
okay.
And the difference is, with dentistry, you do not have to do a residency of any kind.
Yeah.
After you graduate from dental school and pass your licensing exam, you can start working. In
Okay.
medicine, after you finish medical school, depending on
Yeah.
which particular branch of medicine you want to go into, then you apply for a residency program and you go through a residency training in, whether it's internal medicine or surgery or whatever you want to do.
Yeah.
That's an additional step that you do not have to do in dentistry.
Uh-huh. Oh, okay, okay. So, how about let's go into your day-to-day life with dentistry. How does your normal day look like?
Normal day is usually from 9 a.m. to 6 p.m. Wake up, go into the office. We look at the day's schedule. We talk about it as a group. So when I say group, I mean like my front office staff, receptionist, treatment planner, and then my assistants as well. So we go through each patient, talk about what we're planning to do for them that day, so that everyone's familiar, and then we go about our day. On a usual day, we'll see maybe 10 to 14 patients,
Mhm.
doing different procedures from exams and cleanings to fillings, crowns, that kind of stuff.
Okay. So, what is the most common procedure you guys perform?
The most common things as a general dentist are cleanings, fillings, and crowns.
What is the most extreme stuff you do?
Extreme. So as a general dentist, there's a wide variety of things that you are allowed to do, and what you choose to do depends on how much training you have received, whether that's in school or after school. You do training on your own. You can take classes,
Yeah.
so you can do extractions. You can like removing teeth. You can place implants. So there's quite a bit of range as a general dentist that you can do. So like, extractions are kind of the most exciting thing probably for the person who's
So,
outside of dentistry looking into it.
okay. So, what exactly is an extraction?
Extraction is like, say someone has a toothache and the tooth has a really big cavity and we can't fix it, then we have to
Oh,
remove that tooth. So we call that an
oh.
extraction.
Okay. So, how long does that usually take?
Depends on the severity of of the situation. Some teeth come out really easy, some teeth become really complicated. So it could take 5 minutes and it could take an hour, it could take 2 hours. It's a
Oh,
really
okay.
wide range of.
So, you said you were a general dentist. What other specialties of dentistry are there?
So there's quite a few. There's oral and maxillofacial surgery. So for that, then after you finish your dental education, then you apply for that residency program, and then you do that training for usually 6 years, and then you're an oral surgeon. So they take out wisdom teeth, place dental implants, do more complex facial surgeries. You can do orthodontics, so braces. You can do endodontics, which is doing root canals, and more complicated root canals. You can do prosthodontics, which is a field where you're doing complex full mouth rehabilitation. Patients who maybe have lost a lot of teeth and they've had complications from that. So replacing a lot of teeth and doing that in a complex situation. You can do oral pathology. So what that is patients who have like cancer or different diseases, diagnosing and treating that,
Oh, okay.
and pediatrics, so treating kids, uh, and there is a radiology and anesthesiology as well in dentistry. They're
Yeah.
not as common in terms of specialty programs, but they're also there.
Oh,
I don't think I missed anything, but there might be more.
okay. Okay. So you also said that you teach.
Yes.
So how does that work?
So every dental school uh, will have faculty which are like just science faculty, and then also dentists who are teaching the students their hand skills. So what I do, and with a group of quite a few other instructors, is we watch the students and guide them in how to drill in teeth.
Oh, okay.
So when the tooth has a cavity in it, you have to make a hole in the tooth before you can fill it in. So we're teaching them how to do that safely.
Do you guys teach any of the other procedures, or is it just that?
So their coursework is broken into different courses. So the one that specifically I teach in, which I'm a part
Oh,
of,
okay.
is teaching them how to do fillings. So drill into tooth and then putting a filling into it. They have
Oh,
separate
okay.
classes for crowns and root canals, and so each specific field has their own class that they have to take.
So what would you say? What would you say would be the hardest part of your profession?
In private practice, the actual dentistry is not necessarily difficult. Obviously, there are difficult cases that come in and challenging, cases to work on, but it's the managing the business and learning how to
Oh,
do that, which is much more challenging than the actual dentistry. Because you go to school to learn dentistry, so you get taught that part,
yeah, yeah.
but you don't get taught the part about how to run a business.
So is there any challenge that you face that you are okay with sharing with us?
I'll give you one example, which is, I think, a challenge for any business, but specifically for me is uh, having a relationship with an employee that doesn't work out,
Oh,
whether
okay.
that means that the business is not doing well or the employee is not performing to standard and having to maybe let that person go.
Yeah,
It is a difficult thing because, it's a human being. They're working, they're relying on,
yeah,
getting paid. And
yeah,
so managing that situation is
yeah,
difficult.
yeah. How many employees do you have in your clinic, and what are the different roles that they play, and how do you manage them?
So the office is kind of split into front office, which means like receptionist, treatment planner, someone who does billing. And then in the back office, there's me, there's the dentist, and then there are my assistants. It is common in a general dental practice to have a dental hygienist as well. And I can go through the different roles. So the dental assistant is someone who sits next to the doctor, hands the instruments, takes the x-rays,
Yeah.
um, assists with all the different procedures that we do, sterilizes the instruments, that
Oh,
kind
okay.
of thing.
Hmm.
A dental hygienist is someone who goes to school to learn how to do cleanings. So cleanings
Oh,
and deep cleanings.
okay.
So that is something that is some. So cleanings are done pretty routinely in the office. We see quite a few
Yeah.
patients that come in for their regular 6 month visit.
Uh-huh.
They see the doctor for the exam, and then either the doctor or the hygienist will clean their teeth.
Mhm. Yeah.
The reason we have a dentist would have a hygienist working with them is so
Mhm.
that the hygienist is doing the cleanings and then the doctor can do the fillings and other procedures that no one else can do. And
Okay.
then in the front office, you have someone who needs to make appointments, answer phone calls, collect payments.
Mhm.
That's the receptionist. And then whatever procedure we do, we either have to bill the patient for it, so the patient pays for it, or if the patient has insurance, then we have to
Yeah.
communicate with the insurance that this is the procedure we did, this is why we did it, and then based on that, the insurance pays either the patient or the
Oh,
doctor back for that.
okay, okay. So, in you said you started working in 2010, am I correct?
Yes.
So, since then, has technology affected dentistry in any way?
Yeah, so I mean, technology is progressing extremely quickly, particularly in the field of like digital dentistry. So what that means is using the technology of cameras, scanners,
Mhm.
uh, to assist in doing different procedures that we do. Uh, Also, in terms of um, dental implants. So people
Yeah.
who are missing teeth, we try to replace those missing teeth. So
Mhm.
the combination of uh, X-rays and uh, scanning and doing the digital dentistry in order to plan more complex procedures to replace missing teeth for patients is where it's expanding quickly.
Oh.
Another area where dentistry is always changing is in like the materials that we use.
Uh-huh.
So the materials are always improving, always changing, and then different materials need to be um, handled in different ways so that it's a little bit of a learning curve every time there's new material or advances in materials that are introduced.
And also, are there any medicines that you guys prescribe, or is it just procedures you guys do?
So as a general dentist, usually we're prescribing just antibiotics and pain medicine.
Yeah.
We also prescribe like stronger toothpaste and mouthwashes. But most of the time it's in dealing with emergencies where we're prescribing pain medicine and antibiotics. We can treat other conditions depending on our familiarity and comfort,
Mhm.
like different diseases of the mouth, or systemic diseases that have, uh, like in patients who are going through cancer treatments,
Yeah.
usually a problem with that is that they get really dry mouth from the different medications they're taking. So then prescribing specific mouthwashes to help with that isn't, something else we would do.
So, you said patients with cancer, you deal with them as well. So, do you have contact with different specialties outside of dentistry?
Yeah, so depending on the patient and the situation, we would talk with their primary care or their oncologist. Um, before we do certain procedures to make sure it's safe to do it. Like if someone has an infection or a tooth problem while they're going through, uh, you know, chemotherapy, radiation, or different treatments, or not even related to cancer, like if they have a heart problem, other problems, then we do have to coordinate with their physicians to see what is safe for us to do, and
Oh,
if there's
okay.
any adjustments that they need to make to their medications before we do it.
Have you ever adjusted any procedure due to someone having some other problems?
So the most common is, or the thing that comes to mind first is someone who has maybe like a heart problem and they're taking like blood thinners, or they're on blood pressure medication and their blood pressure is not controlled, like it's very
Oh,
high.
yeah,
Then we have to coordinate with the doctor before we can do certain procedures. Like someone who's on blood thinners and we need to
yeah,
do take out a tooth for them, they're at a high risk of bleeding. So we
yeah.
want to make sure it's safe to do it
Uh-huh.
before we
Oh,
do it.
okay. Okay. What advice would you give to high schoolers who are going into dentistry?
So if you're interested in dentistry, the first thing you need to know that it's very competitive, like getting into dental school, because that's usually the focus is like, what do I got to do to get into dental school? And it's just work hard.
Yeah,
Um, you have to be very focused, very driven to maintain your grades.
yeah,
And then also you need to have some, extracurricular activities. You don't want to do like a million extracurricular activities. You want to find a couple that you're passionate about, um, that you can show that you really worked hard to become a part of like certain organizations or certain causes, uh, and
yeah,
done like real work.
yeah,
Because when you go through the process of getting into undergrad and then graduate school or dental school, at some point you're going to go through like an interview process and you're going to have to write a
yeah.
personal statement. So you
Mm-hmm.
want to be able to show that not only are you interested in, you know, certain
Yeah,
subjects or certain
yeah,
extracurricular activities, but you've participated and really gotten into leadership roles,
yeah,
like meaningful activity that you
yeah.
can share your experience with, to show that
Okay.
you
So,
have that level of commitment, that you can follow through on things that you're passionate about.
oh, okay. So do those have extracurriculars have to be related to dentistry, or can they be anything?
I think it can be anything. It helps that maybe one of them is related to healthcare in some way or form,
Oh, okay.
but more just because you go to dental school, dentistry isn't the only thing that you are. A dentist isn't the only thing that a person
Oh,
is, right? You have different interests and things that you
yeah.
love. So
Mm-hmm.
just showing that once you show that you have a commitment to something, that you really do follow through on it, is important.
Yeah, okay. So, another question I had was like in medical school, people have rotations through different specialties,
Yeah.
to find like which one they actually want to go to. Does dentistry have that as well?
So similarly in dental school, we'll have different departments. So we'll have a pediatric department where you'll go and you'll
Oh,
you'll treat children in that department under the care of pediatric specialists. When the students are learning how to take out teeth, they go to the oral surgery department and they're working under oral surgeons.
okay.
And when they're learning how to do root canals, so they're working under endodontists. So it's like a similar process, but it's kind of contained within the dental school.
Oh, okay. What made you choose general dentistry?
I liked, doing a little bit of everything. I enjoyed in dental school. I enjoyed taking out teeth. I enjoyed
Okay.
doing root canals. I enjoyed, doing deep cleanings and taking care of the gums. So because I kind of like doing a little bit of everything, then it made
Uh-huh.
sense to be a general dentist because
Oh, okay.
I can do a little bit of everything.
Mm-hmm.
Also, my mom is a general dentist, and
Uh-huh. Yeah.
so that definitely had an influence.
What quality would you say you have to go through dentistry school?
You have to be resilient because it's very challenging.
Yes.
The change in the amount of work that you have to do from high school to college and then to graduate school or dental school is pretty significant. In
Okay.
college, you might be taking 3 or 4 classes a term, maybe five if you're ambitious. So in terms of units, that might be like 15, 16, 17.
Yeah.
Then you get to dental school, it's like 25 to 30 units. It's
Okay.
intense. The time
So
commitment is a lot. The students are here probably from 8 in the morning, maybe 8, 9, 10 o'clock at night.
okay,
The course, the classes they're taking are contained from like, 8 to 4, but then just staying and doing lab work, different projects that they have to catch up on and studying.
yeah,
It's an all day
okay.
kind of thing every day.
Oh, okay. So do the courses include the actual dentistry with the patients, or or is that separate on top of the
So
courses?
so the patient care portion of your education is in your last 2 years.
Mhm.
The first
Oh,
year here at UOP, and then the first 2 years at all the other schools is
uh-huh.
you're learning the science and the foundation information behind what you're doing. And then also you're practicing on plastic teeth, learning how to use
Oh,
the
okay.
drill.
Well, okay. One other thing that a lot of high schoolers look at is how much am I gonna make? So how much do general dentists generally make?
It depends on the area that you live in, has an effect. And you'll find different information online, but it varies significantly depending on, how many days a week you're working.
Yeah.
But average, I think in the Bay Area is probably around 200
Hmm.
thousand, give or
Oh,
take. Could be a lot more, could be a little bit less, but it just depends. Different
okay.
areas where there's maybe more demand for doctors, where people aren't living, going to necessarily, might
Yeah.
be able to pay more. Where it's more densely populated, where there's more dentists, then it might be a little bit less because there's more competition. So
Oh, okay.
it varies significantly.
Would you say there's an abundance of dentists in the Bay Area, or are there not enough?
I would say it's pretty competitive, so there's quite a few.
Oh, okay, okay.
Yeah, because people want to live in the Bay Area. So
Yeah, yeah. So, also, what's the difference between working at a hospital? Wait, do dentists work at a hospital, or is it just private?
so dentists, there are dentists that do some hospital dentistry.
Mhm.
Uh, for example, there are like special needs
Yeah,
patients who need to be sedated in order to do dentistry. That
yeah,
would be done in a hospital setting. Oral surgeons will sometimes be on staff at hospitals, like for example in the emergency room, where accidents can happen with damage to the
yeah,
mouth, where they can
yeah.
come in and treat patients,
Uh-huh.
but not necessarily like a general dentist being on staff all
Okay,
the time at all the hospitals. That's not
okay.
something every hospital would have.
So dentists usually either work in private clinic or in an educational setting?
Yeah, because in a
Oh,
hospital setting, the only real reason you would have a dentist like there would be if there's an emergency. And most emergencies that require being in the emergency room, it would be related,
yeah,
something that an oral surgeon would need to do, like trauma.
yeah,
But if you're having like a tooth problem and the tooth hurts or tooth breaks,
yeah.
generally it's not a life or death situation. You'll be in a lot of pain, you'll be uncomfortable.
Okay.
But usually that can be managed with just pain medicine, like, if you're taking some Advil or Tylenol just to deal with the pain until a dentist can see you in the office like the next day.
If dentists don't work in the hospital, do they still work for organizations like for John Hopkins or like Stanford Medicine? Do they still work for those organizations, healthcare organization?
Maybe,
Oh, okay.
but I don't know specifically.
Okay, okay.
Yeah.
Um, well, I think that's it. Do you have any last words for
Um,
the audience?
no, I mean, if you're interested in dentistry and medicine, um, good luck to you because they're great fields to be in. You get to take care of people and earn a good
Huh.
living at the same time.
Yeah,
But you really have to work hard, be resilient. There's a lot of competition to get into these fields.
yeah,
The way you want to separate yourself is by showing that you care about people, because at the end of the day, there's a person in the chair who's relying on you to treat them compassionately, and with good decision making, good judgment, based on your science and your education.
uh-huh.
Um, so you want to make sure that you're not doing it just to make money,
Huh.
because
Yeah.
there's plenty of ways to make money. You want to do it because you want to take care of people.
Okay, one last question I just remembered. I've always seen dentists wear those glasses with those things on them. What are those?
Oh, yeah, I have mine. I can bust them out. All right. So we call them loops. So what they are, they're magnifying glasses.
Mhm.
So I have mine right here.
Oh, okay, okay.
So these ones will magnify whatever I'm looking at 2.5 times.
Oh, okay, okay.
You know, the more you can see, the better you can do
Yeah.
in terms of taking care of the details of a tooth. They come in different sizes, different magnifications. You can get some that are 5 times magnification. They
Okay.
look really big, but it just allows us to see in more detail and bigger
Okay.
size so that we can do a better job.
Well, thank you, Dr. Sayed. It was great having you here on my channel. I hope you guys learned a lot from this video and comment down other specialties that you guys want and like and subscribe. Thank you and see you next time.